Medical Eligibility Criteria Wheel for Contraceptive Use 2018, which is a WHO approved tool to help you give the quality family planning method. So this is a magical wheel whereby I use it to determine what family planning method I'm going to give to each of my patients. So it's so very easy to use it because you just rotate the wheel to a certain patient. For example, if a patient has a breast cancer, you'll get to know which type of family planning that you're going to use. So how does this wheel work? So as you can see, it is rotating like this, as you can see. So here you've got various type of family planning. You've got pills, which is progesterone only, and you have combined. You've got injections, you've got implant, you've got IUCD, both copper and levonorgestrel IUCD. Then over here we've got permanent methods whereby you've got vasectomy and BTL. So this section and this section is just giving you the method or the family planning method that you can use. But over here, round you can see you've got various type of diseases. As you can see, you've got adolescents, you've got vaginal bleeding, uterine fibroids, you've got cervical neoplasia, cervical cancer, breast cancer, liver disease, thromboembolism, cardiovascular disease, patient with hypertension, obesity, diabetes, smoking, headache, medication, patient with HIV, sexually transmitted infections, patient with PID, sepsis. Then we've got postpartum and breastfeeding. Then we are back to nulliparity. So those are the conditions of certain patients that we attend. So what happens if I have a patient who has just given birth? So this is a postpartum and breastfeeding mothers, and is less than 48 hours. This mother has presented to me. So you just rotate this wheel like this. You go to less than 48 hours. So this mother has just given birth. So as you can see here in between, we have numbers. We have 4, we have 2, we have 3, we have 2, we have 2, we have 1. So what does that mean? So if you're given number 1 and number 2, like here, number 1 and number 2, number 2. So number 1 and number 2, it means that you can comfortably give that type of a method to that patient. But if you see a number 3 or number 4, it means that you cannot give that family planning to that patient. For example, let's continue. If a patient has just given birth and is less than 48 hours and the mother has presented to you for a family planning method, so what I do, you just rotate, you come to less than 48 hours. So you'll find that this mother, I can't give her a combined hormonal contraceptives, and I can also not give her progesterone only injectable. So I can't give her both injectable, which is progesterone only, and I can't give combined oral contraceptive. However, I can comfortably give progesterone only pills because it's giving me number 2. I can also give implants, and I can also give IUCD, which is copper, and levonorgestrel, which is giving me 1 and 2 respectively. And also I can also give BTL for this patient. So that is less than 48 hours. So if this mother presents to me 48 hours to less than 4 weeks postpartum, so there are various methods that I can use and others I can't use. Here I can't use combined oral contraceptive for this mother, and I can also not use progesterone only injectable for this mother, and also I can't give IUCD for this mother. As you can see, it's giving me 3 and 3. So what is safe for this mother who is 48 to more than 48 hours and less than 4 weeks after delivery, I can give implants because it's giving me 2, and also I can give progesterone only pills because it's giving me 2. But I can't give combined hormonal contraceptives, and also I can't give progesterone only injectable. That is 48 hours to less than 4 weeks postpartum. 4 weeks to 6 weeks postpartum, and this mother is breastfeeding, I can comfortably give this mother progesterone only pills, and I can give implants, and I can also give this mother IUCD, both copper and levonorgestrel IUCD, and also there's room for BTL. But I can't give this mother combined hormonal contraceptives because it's giving me 4, and also I can't give progesterone only injectable. I can't for this mother who is between 4 and 6 weeks. So this mother presents to me when they are 6 weeks postpartum and they are breastfeeding. So now here there are various methods that I can give them. There is room for IUCD, both copper, levonorgestrel. There is room to give this patient an implant. There is room to give this patient progesterone only injectable, and I can give progesterone only pills. But at this point, because we are less than 6 weeks, I can't give this mother combined hormonal contraceptives because they are breastfeeding and they are less than 6 weeks. So now we are done with postpartum and breastfeeding. So now you understand, less than 48 hours if you present to me, the method that I'm going to give you. 48 hours to 4 weeks, the method that I'm going to give you. 4 weeks to 6 weeks, the method. And then when you're less than 6 weeks, the method that I'm going to give you, depending on these MEC wheel, medical eligibility criteria wheel. So in a scenario whereby a mother or a lady who has not given birth, they are called nulliparity. They present to me and they want a family planning method. So as you can see, basically they are eligible to all types of family planning that are presented to us here. You can see they are eligible for combined hormonal contraceptives, progesterone only. I can give progesterone only injectables, implants, and IUCD. And also there's room for them to do a BTL, though at this point it can be very difficult to give them a BTL because already they have not given birth. An adolescent present to me who is less than 18 years and they are eligible for family planning. So I just will to where an adolescent is who is less than 18 years, and you can see all the methods that this girl or this lady is eligible for because it's giving me 1, 1, and 2. So it means that all this method this lady is eligible to be given. Combined hormonal contraceptives, progesterone only pills, injectables, implants, and IUCD, as you can see. So next, if a mother comes to me with vaginal bleeding, which is unexplained, we don't know where this bleeding is coming from, and she wants a family planning. So what do? I just wheel to where there is vaginal bleeding, which is unexplained. I see what I can give for this mother and what I cannot give her. So as you can see, most of the family planning here, I can't give to this mother. For example, I can't give you IUCD to this mother. I can't give implants, and I can't give progesterone only injectable. So the only thing that is I can give to this mother, their pills. As you can see, it's only progesterone only pills and combined hormonal contraceptives that are I can give to this mother. So next, a mother with uterine fibroids present to me. Basically, this one almost get everything in this chart because I can see all of them is they're giving me number 1, all of them. So I can give IUD, I can give implants, I can give injectables, and I can give pills, both combined and progesterone only. So a scenario whereby a mother has a condition like cervical neoplasia, I can give all the methods that are here: IUCD, implants, injectables, pills, and also a room for BTL. So a cervical cancer whereby there is this, they are on their pre-treatment stage. So this patient has cervical cancer, presents to me and wants a family planning method. So I just wheel it to where cervical cancer is. So as you can see, I can't insert an IUCD to this mother, both copper and levonorgestrel, but I can give this mother an implant. I can also give her some injectables and some pills, both combined and progesterone only. A patient with breast cancer, basically it's giving you me 4 in most of the family planning, and the only thing that is safe for this mother is copper IUD for a patient with breast cancer. So patient with liver disease, let's wheel it and see what we can give the mother. If a mother has a liver disease, if a mother has a liver tumor, basically most of the family planning, they are not safe for her. For example, combined hormonal contraceptives, those are pills, patch, ring, injectables. If they are combined, I can't give. Progesterone only pills, they are not safe. Injectables, progesterone only, not safe. Implants, not safe. IUD, which is levonorgestrel, not safe, but I can use copper IUD for this patient. And also we can do BTL for this patient. So when you have a patient with hepatitis acute, which is acute, basically most of the methods I can give, except combined hormonal contraceptives, which is giving me 3/4. The rest, which is progesterone only, injectables, which is progesterone only, implants, I can give IUD, both copper and levonorgestrel. They are safe for this mother. So a mother with venous thromboembolism presents to me, wants some family planning method. Basically the only thing here I can't give is combined hormonal contraceptives for her. That is in terms of pills, patch, ring, injectables, that is combined, that has combined hormonal contraceptives, I can't give her, but the rest I can. So in terms of pills, which is progesterone only, injectables, implants, IUD, all of them I can give to this mother. So when this patient has acute venous thromboembolism, as you can see, basically most of the family planning I cannot give her. The only thing I can comfortably insert is a copper IUD for this mother. Otherwise, the IUD, levonorgestrel, implants, injectables, pills, both progesterone only and combined hormonal contraceptives, they are not safe for this mother. A mother who has undergone major surgery with prolonged immobilization, that is, this mother is not moving, that means they are bedridden for quite some time. So I cannot give this mother combined hormonal contraceptives because there can be a chance of this mother having an embolism. So the rest of the methods, they are safe. Progesterone only pills, injectables, implants, IUD, all of them. So a patient with cardiac disease, for example, this patient has had a stroke. So I can't give combined hormonal contraceptives and I can't give progesterone only injectables. I can't, whether subcute or IM. But progesterone only pills, implants, IUD, both copper and levonorgestrel, BTL, all of them, they are safe for this patient. So we have cardiovascular disease like ischemic heart disease, and it's giving me number 4 in combined hormonal contraceptives. So don't give combined and don't give progesterone injections. So what is safe for me to give here is progesterone only pills, I can give implants and IUD for this patient. So patient with multiple risk factor present to me, and I have to give family planning. So what is safe for this mother? Copper IUD, levonorgestrel IUD, implants, progesterone only pills. But for combined hormonal contraceptives, I can't give. Progesterone only injectables, don't give. Higher. A hypertensive patient present to me with a diastolic of 90 to 99 with a systolic of 140, 159. I can't give combined hormonal contraceptives, but all the other methods, progesterone only pills, injectables, implants, IUD, they're safe for this mother. So a patient still with hypertension over diastolic of over 100 and a systolic of 160, less than 100 and less than 160. Basically, combined hormonal contraceptives and progesterone only not advisable, but progesterone only pills, implants, levonorgestrel, and copper IUD safe for this mother. So, an obese mother come to my clinic with a BMI which is less than 30. Basically, is I can give almost, in fact, I can give all type of family planning presented over here: combined oral contraceptive, injections, implants, and IUD for this mother. For diabetic patients, basically all of them, they're safe for her. As you can see, most of them is giving me 2, 2, and 1. So that means I can give combined oral hormonal contraceptives, progesterone only pills, injectables, implants, IUD, all those. So a client who is smoking and less than 35 years presents into my clinic, wants some family planning. As you can see, is eligible for all of the family planning presented here. So smoking client who is more than 35 years of age presents for family planning. I just wheel it, I see what is safe for her, what is not safe for her. And in this case, what is not safe for this woman who is more than 35 years and smoking is combined hormonal contraceptives. So a patient with migraine, which is non-migraine, basically qualifies for all the family planning presented to us, be it IUD, implants, injections, pills, both combined and uncombined, all of them. So patient presenting with headache, that is migraine with aura, it's not safe to give combined hormonal contraceptives, but all the others, they're very safe for this patient. So let's go to medication. So some patients can present to you and they are on various medication. For example, a patient can be taking anticonvulsants and she wants a family planning, so we can't deny her. So I just will to where some anticonvulsants are. And as you can see, combined hormonal contraceptives and progesterone only pills not safe for this mother. But when you come to injections, implants, IUD for these patients, you can use them. So a patient who is taking rifampicin and rifabutin, these are TB medication, progesterone only pills, combined hormonal contraceptives, be it in terms of pill, patch, ring, injections, not safe for this mother because it's giving me 3 and 3. But when you come to injections, when you come to implant, when you come to IUD, both copper and levonorgestrel, they're safe for this mother to use. So a patient who is using antiretroviral drugs comes into the clinic, comes into the clinic and wants some family planning. So I can give combined hormonal contraceptives, progesterone only, injectable, very safe, implant safe. But over here you can see they're giving me 2 and 3, 2 and 3. So it means that here we are going to use our IUD with caution. You can give, but it's also giving us 3, so we are using with caution. We can also do a BTL for this mother. So a patient who is HIV positive presenting with to you and already they are in stage 3 or 4. Let's see what they can use and what they can't use. So IUD, copper, levonorgestrel, not safe for this mother, but implant safe, injection safe, and pills they're safe. Both combined hormonal contraceptives and progesterone only, they are very safe for this mother who is in stage 3 and stage 4. So patients with sexually transmitted infections present to you or present to my clinic and they want family planning. So they have gonorrhea or chlamydia infections, sexually transmitted infections. So basically, I can't give IUD, both copper and levonorgestrel, because it's giving me 4. But for implant, injections, pills, both progesterone and combined hormonal contraceptives, very safe for them. And other infections like STIs and vaginitis, it's giving me 1, 1, 2, 2. That means all the family planning that are available here, I can comfortably give them. So patient with increased risk of STIs, that means I can give pills, combined progesterone only, and I can give progesterone injections, I can give implants. But when you come here to IUD, it's giving you 2 and 3. So you can use, but with caution. You can use, but with caution. So when you come to PID, patients who are currently with PID infections, it's giving me 1 in most of family planning methods like combined hormonal contraceptives, pills, progesterone only, injections, implants. But when you come to IUD, copper and levonorgestrel, IUD not safe to use for this mother. So the last type of condition is sepsis, like after birth, which is puerperal or postpartum. Most of them, they are safe to use, progesterone only, pills, combined hormonal contraceptives, injection, implants, they are safe to use. But when it comes to IUD, both copper and levonorgestrel, not safe. So that's all. We had started here less than 48 hours postpartum, and breastfeeding, that one is, I think it's covered. So that's how easily I usually know what type of contraceptive method to use for which patient. So it's usually so easy for me to determine which type of family planning to use.